Good evening, class. Welcome to our lesson number 2. Yesterday, we finished our lesson number 1, which was about injury, illness, and disease. Today, we'll continue to lesson number 2. This lesson is about parts of the body. In this lesson, you'll learn how our patients describe their body. You'll also learn functions of the body. The most common ones you'll hear when talking about patient. Now, let's begin. Okay, now, most external parts of the body have ordinary English names, as well as anatomical names. Doctors normally use the English names, even when talking to each other. But there are a few exceptions where doctors use the anatomical name. Here you have 40 of the most common parts of the body. Maybe you know most of these words, but still we're going to repeat them. So now in this image, you can see parts of the body indicated by numbers from 1 to 40. Now I want you to read them and memorize them, and also I want you to write it on a piece of paper. First we have ear. Number 2 we have cheek. Number 3, jaw. Number 4, neck. Number 5, shoulder. Number 6, armpit. Number 7, upper arm. Number 8, elbow. Number 9, loin. Or back. Number 10, forearm. Number 11, buttock. Number 12, wrist. Number 13, hand. Number 14, thumb. Number 15, finger. Number 16, thigh. Number 17, calf. Number 18, leg. Number 19, foot. Number 20, toe. Number 21, hair. Number 22, forehead. Number 23, nose. Number 24, chin, chin. Number 25. Adam's apple, Adam's apple. Or laryngeal prominence, laryngeal prominence. Number 26. Chest, chest. Or thorax, thorax. Number 27. Nipple, nipple. Number 28. Breast, breast. Number 29. Stomach, stomach. Or tummy, tummy. Or belly, belly. Or abdomen, abdomen. Number 30. Navel, navel. Or belly button, belly button. Number 31. Hip, hip. Number 32. Palm, palm. Number 33. Groin, groin. Or inguinal region, inguinal region. Number 34. Genitals, genitals. Number 35. Knee, knee. Or kneecap, kneecap. But with kneecap, we are referring to the convex bone in front of our knee joint. Number 36. Shin, shin. Number 37. Ankle, ankle. Number 38. Big toe, big toe. Number 39. Sole, sole. Number 40. Heel, heel. So now repeat as many times as you need to memorize all of these words. Referring to parts of the body. Usually, when patients speak about their problems, they often refer to a part of the body, like, for example, I'm having trouble with my hip, or I'm having trouble with my shoulder, or with my knee. Patients usually use these expressions when they feel pain in those parts of their bodies. But The doctor often needs to ask about a part of the body, like when he says, "Do you get any pain in the chest?" Or "Do you get any pain in your back, your stomach?" But how are patients describe their pain? Well, they usually describe, like in this example. They say things like, "I feel pain, doctor. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh to the knee." This is an example of how our patients describe their radiation of pain. I'll give you some exercises to practice a little bit about this first part of the lesson. As you can see in this chart, we have some of the words we have learned before, but what's the difference? These are the anatomical terms, and I want you to write the corresponding English words for each of them. So write the ordinary English words for the corresponding anatomical terms in the table using your medical knowledge. I'll give you 5 minutes to complete this part of the exercise. Now let's check your answers. I'll read the answers for you to check if you did it right. Stomach, or tummy, or belly. Armpit, wrist, hip, elbow, breast, buttock, kneecap. Okay, I hope you did it right. For our next exercise, we have sentences you have to complete. I'll give you another 5 minutes so you can read carefully and answer this exercise. Now check if you did it right. It's like a thymus across my chest, and it goes up into my neck or jaw, and into my left shoulder and down the left arm. Again, it's like a tightness across my chest, and it goes up into my neck or jaw and into my left shoulder and down the left arm. For the second one, we have it starts in the loin and goes into the groin and down into the testicle. Again, it starts in the loin and goes into the groin and down into the testicle. Here we have another exercise for you to practice what we learned. On the left side, we have the anatomical term, and on the right side, we have our patient's statement, so you have to complete with the ordinary English word. I'll give you 5 minutes as usual for you to complete this exercise. Start now. Now let's check your answers. Now for the first one, which is inguinal swelling, the correct answer is groin. I've got a lump in the groin. I've got a lump in the groin. Now, the second one, referring to abdominal pain, was tummy or stomach. My little boy's got a stomachache. My little boy's got a stomachache. The next one is periumbilical rash. Its correct answer is navel. I've got some spots around my navel. I've got some spots around my navel. Next, thoracic pain. Its correct answer is chest. I've got a pain in the middle of the chest. I've got a pain in the middle of the chest. Next, we have enlarged axillary node. The correct answer is armpit. There's a painful swelling in my armpit. Then we have mandibular pain, and its correct answer is jaw. So we have, I got a pain in my jaw. Okay, so now here you have your last exercise of this part of the lesson. Here you have a table where you have to complete with the words from the box. It is pretty easy, so you can start now. So now let's check your answers. For the trunk, we have abdomen, chest, and loin. For the upper limb, we have elbow, finger, wrist, and arm. And lastly, for the lower limb, we have knee, leg, and thigh.